did you see a difference how she had her information more organized in the second scene, even though her recommendation was really interesting. But the first one, she didn't have any organization. There was nothing really. She was wasting his time. And maybe if she was talking to a fellow nurse, she could be pretty descriptive like that. I mean, we talk about things differently than physicians. He just wants to know what the problem is and move on. And she, with having her information better organized, she was able to convey to him what the seriousness of the problem was, and then something can be done about it. And now we're going to talk about the patient handoff. We're talking to
the Joint Commission on the Accreditation of Healthcare Organizations has made patient handoffs a national patient safety goal. SBAR can help ease these transitions by providing relevant information in a brief, clear way. Remember, these handoffs require caregivers to provide time to ask and answer questions. By using SBAR, you may be able to answer most questions before they're asked.
Okay, Johnson in 14 is unstable and needs to be watched. He was admitted after a fall and head trauma at work and has had a couple of instances of chest pains and unstable vitals. We called an RRT for him last night, so keep an eye on it. And 16 is Miller, and he's sick.
Which Johnson was that? There are two on the floor.
Okay, Andrew Johnson. Andrew, 14.
Okay, and what were his vitals at last check?
Well, it's all in the chart. Can we move on, please? So anyway, Miller in 16. He's stable now, and
In that last scene, the information provided was vague and confusing. If the nurse leaving the floor had used SBAR, then the nurse starting her shift would have understood why the RRT call was made, what bearing it had on the patient's care, and what steps to take from there.
Okay, next is Andrew Johnson in 14. He was admitted after falling at work and hitting his head. The patient is stable now, and at last check his blood pressure was 130/80, and his heart rate was in the 70s. We called the RRT last night to treat him, and he's since stabilized. Still, his condition's unsettled, so you'll need to keep an eye on him over the next 8 hours or so.
Okay. Do you have the report from the RRT visit?
Oh, yeah, right here. Would you like me to go over it with you? Yeah. Okay. So we listed up.
So you can see a difference between when the handoff, he was nicer in the second part, and he was better organized. So it makes a big difference when you're ready with your information whenever you convey communication, because things can happen, and they do happen, unfortunately. Do you have any questions about the video or anything? Okay, here's the example we're going to do in class. You have the SBAR template at the end of your PowerPoint slides. It shows the SBARs on the left-hand column after the example. Everybody find it? So, this is, I'm going to have you guys do a quick rundown of what you're going to say, like when you're calling the physician. So you can, I'll read to you just in case you can't read it over on the slide. This is, okay, John Crum was admitted 3 days ago with a diagnosis of congestive heart failure. Yesterday, the patient was transferred from the CCU to your floor. This is your first day having the patient, the second day the patient's been on your floor. This is, breakfast trays are being picked up by the clinical assistants, and you're giving the morning medications to the patient. You ask him how he's feeling, and he says, great. Especially since he's off that crummy jello and bland food diet from the CCU. He goes on to tell you that he enjoyed breakfast, he loved the bacon, he wants to have the same breakfast tomorrow, and he also enjoyed last night's dinner because it was oh so tasty and salty. You notice that his weight is up 2 pounds today from when he was, well, 2 pounds from when he was in the CCU, and you check his dietary order and you notice it says regular. Well, he has an increased edema in his feet. His blood pressure is slightly elevated this morning at 164/102 compared to last night's 152/98. You are this patient's nurse, and you're going to call a physician to provide information about him because you, well, what do you think needs to be done? A diet change. Exactly. You probably want a elevated low sodium. You also feel perhaps that some Lasix may be needed because of the rising blood pressure, the weight gain, and maybe he's sounding a little wet in his lungs. So you can work with other, work together and just do a quick SBAR template of what you're going to do, and I'll pick somebody that can tell me what they're going to tell the physician. Does anybody else want to give what they've said? Okay.
I'm Sharon Burgess from Qualities and calling about drawing on the patient in 503. He's related to congestive heart failure and he's 2 days post-surgery from CCU. His weight is up 2 pounds. Yesterday his blood pressure was up to 164 over 102, and he has a beamer in his feet. He's also on a regular diet. I'm concerned the CHS is getting worse. What about changing his diet to low sodium and giving him some lysips?
Okay, that's good. Did you guys kind of understand how SBAR can help facilitate better communication? That was my goal.
Would the gain 2 pounds, increased edema, and vital signs, would that be under background or assessment?
That would be, that's kind of question. It could be an either.
Okay.
I mean, that is a new assessment, what his new blood pressure is, with background. I would have to say assessment, because you're the first one that's kind of noticing it. The background is he's been admitted for CHF, stuff like that. Okay, so on the flip side of your SBAR template, there is a quick quiz we'll go through. See how much you guys learned. Okay, those are true false. The first question, when the Joint Commission studied root causes for sentinel events, they found that communication breakdown was number 3. False. Yes. What number what was it? Number 1. It was 1. Exactly. SBAR is only appropriate in clinical conversations. True or false? False. Exactly. It can be used in non-clinical conversations, in emails, presentations, whatnot. When conveying the S part of SBAR, it should take as long as you think it should, as long as you're communicating what you need. How long should it take? 12 seconds. The Joint Commission has a patient safety goal that specifies all hospitals need to have a standardized approach for handoff communication. Right. Even though we're using SBAR, and I still need to end my conversation with what questions do you have for me, so it can be a two-way communication. Sure. So what does SBAR stand for without looking at the board? Situation. Exactly. So at RMH, what is our standardized communication handoff for communications in the event that the Joint Commission might ask you this question? At SBAR. Did everybody have fun? Yes.